one of her major portfolios is as a coordinator of the Nurse Transition to Ped ICU program, and that's what she's going to talk to us about today, which was part of her minor thesis.
It was, yes. Thank you all for staying for the very last session on the very longest day. I'll try not to take too long. So, as Tina has mentioned, I'm a nurse educator at the Children's Hospital in the Paediatric ICU, and part of my minor thesis was a study looking at the knowledge outcomes of our transition program to PICU that we run. We conduct it twice a year for groups of around sort of 10 to 15 nurses, and we sought to, over a period of 9 months from September 2017 until May this year, to evaluate one of those programs. So transition to specialty practice and transition to intensive care programs are not a new concept. There's been discussions in the literature sort of dating back to the early 1990s, and they can take a number of different forms, from sort of an extended orientation program, which may range from days to weeks, to more comprehensive formal programs that can range anywhere from months to a year. Most of the programs that are described in the literature relate to adult-based transition to intensive care programs, and most of the outcome measures that are discussed in the literature tend to relate to organisational type outcomes of retention, recruitment, and participant satisfaction, sort of more of those happy sheets that we hear about. Transition to paediatric intensive care programs have really evolved out of the recognition that paediatric intensive care is a specialty in its own right, with its own key knowledge and skills, and to prepare nurses who have not worked in that area before adequately to function in a safe and competent manner to provide care to critically ill children and their families, we need to provide some sort of program to help facilitate that. So our program is aimed to prepare novice nurses, and when we talk about novice nurses in this instance, we're thinking of nurses who may well be very experienced in other areas, but when they move to a critical care environment, they can then be considered to be novice nurses in that particular area. And when we're thinking about paediatric transition programs, there's very little evidence in the literature in evaluating what those programs are. So the current program that we looked at is a 12-week duration program that is run twice a year for anywhere between 10 to 15 nurses, and we've been running it in its current form since 2012. It's a combination of supernumerary time and 10 study days where they get a mixture of didactic sessions and some skill sessions, and then there's a process of ongoing clinical support for the period of the program itself. But it's really time and resource intensive, and in times when funding is short, we really need to sort of have a little bit more evaluation of the program rather than, yes, everyone loves it. And that's all the evaluation we've had to date. Participant feedback at the end of the program, and while certainly it's reassuring to know that everyone really values the program, and they don't, a lot of the comments will say that they don't feel they could make that transition to PICU without the support of some sort of program. We don't really have any true evaluation that's based on the outcomes of the program itself. So what we were looking to do was maybe try and evaluate the program based on its key objectives. So formally, the aim of the study was to evaluate the knowledge outcomes of novice PICU nurses following a 12-week transition to paediatric intensive care program. And a secondary objective was looking to then compare these knowledge outcomes of the novice nurses with a group of experienced PICU nurses, just to see where their knowledge growth lay within the group. Knowledge itself is recognised as a foundational component of competence, and we know it's really vital for use in problem solving and critical thinking. And it is one measure of competence, one component of competence that we can measure objectively and reliably, and it can then be linked to the key learning outcomes. So that was why we decided to, as one part of the study, to use knowledge outcomes as the assessment. The test we used was a modification of a previously validated paediatric intensive care nursing knowledge skill test, which was developed in Brisbane by, where's Debbie? She's gone. Oh, there you are, sorry. By Debbie Long and her associates. And that was a validated tool in the Australian and New Zealand nursing ICU PICU population. It was initially a 109 item multiple choice quiz, and we modified this by looking at the individual questions. We took out questions that related to advanced practice skills that really weren't appropriate for novice nurses coming into the unit, things like oscillation and pacing. And then we also modified some of the questions to relate more to local practice, so adjusted questions related to different ventilation modes and choice of inotropes that we would maybe differ from practice in Queensland to our particular unit. But it did cover the foundational knowledge and skills of the program, and it took about 60 minutes to complete. The design we used was a quasi-experimental time series design where we took the intervention group or the novice PICU nurses and we tested them at 3 different time frames. So T1 was at the very beginning of the program, T2 is right at the completion of the program, and then T3, which was between 7 to 8 months after starting in PICU. That couldn't be done on one particular day because by this stage the nurses were very much embedded in their roster in ICU, and we had to accommodate around rostering and leave and all those things, so it happened over a period of time. During that T3 testing, we also then undertook to test a group of experienced PICU nurses, and we tested 25 nurses as well of various levels of experience, but most of them tended to have some sort of postgraduate ICU qualification. The median test results, we looked at median scores because initial data was sort of non-normally distributed, shows a growth in, I can't even see with my glasses on, a growth in the median score from a 33 at the beginning of the program, 33 out of a possible 60, up to 38 of a possible 60 at the completion of the program, and that had a significance with a p-value of 0.001. What was really reassuring was that whilst not statistically significant, there was still small knowledge growth, or at least maintenance of knowledge at that T3 timeframe. So sort of 4 to 5 months after completing the program, they were still demonstrating equal or better knowledge that they from when they started. Not surprisingly though, the experienced PICU nurses had a significant greater result with an average or a median score of 47 out of a possible 60 as compared to the novice nurses at 40. So whilst, yes, there is growth following a transition to paediatric intensive care program, it's certainly not to the same degree as what you would expect from experienced PICU nurses. And it probably adds a little bit of support to our ideas that, you know, there's people outside of critical care areas that say, oh, they've done the course, they can do this, they can do that. Well, actually, no, they're still really novice or maybe advanced beginner practitioners. They're not necessarily expert experienced PICU nurses. We further delved into the test itself and had a look a little bit at the specific knowledge domains within the quiz and divided that into the 6 main knowledge domains that we sought to provide to the nurses to be able to practice in the unit. This shows the percentage correct in each of the different domains at the 3 different timeframes, and it pretty much shows a similar sort of pattern of growth and development from T1 to T2 and then again T3, and with the experienced PICU nurses having the greatest level in all domains. What probably stands out in all of it is the respiratory domain, which the nurses right at the beginning started off with potentially greater knowledge than what they did with the other domains, and had a really big jump at the end of the program, which then probably dipped back down again at T3. that then sort of seems to have balanced itself out, though, with at T3 it really is sort of following the same sort of pattern of growth as the others. So does this mean we need to sort of look at the questions and perhaps some of those initial questions maybe is knowledge that the nurses already had and might need a slight modification on that basis? So significance and implications. So this is the first study to report knowledge development following a transition to PICU program, and it demonstrated not only growth at the end of the program but sustained growth. The results have already been used to modify the program that we commenced in September this year, and we will look to evaluate that at the completion of, if not this program, maybe a couple of programs' time. But I think knowledge assessment really provides opportunities to look at it in a number of different ways, and whether that's at evaluating outcomes of programs that we run, or whether it's looking at assessing knowledge in new or existing staff members, particularly if you're breaking it down into different domains, just to assess where knowledge gap exists and maybe to have a bit more focused direction for education. Limitations, obviously very small sample sizes, but we're limited by the number of staff that we can employ in at any one time. It was a single study type, and we have to acknowledge that by giving a multiple choice quiz to someone on repeated occasions, you potentially can have a learning effect within that. So in conclusion, specific knowledge in paediatric intensive care significantly increased and was maintained in novice nurses following transition to paediatric intensive care programs, but experienced PICU nurses still demonstrated a significantly greater level of knowledge, and that the modified knowledge test, PICU nursing knowledge and skill test, is a suitable measurement for beginning PICU knowledge. Thank you. Questions?
Great. Does anyone have a question for Kim? Oh, yes.
Of course you would, David.
Yes, we've actually got a couple of people here. I don't know if the microphone's anywhere near you. We do have time for a couple of questions.
Thank you, Kim. Great talk. I'm flattered. My question is about retention out further, and do you have any plans to assess again, or is there any point in doing that? Mm-hmm. And also, if you did, how would you account for exposure and practice to that knowledge retention? I mean, there's one thing that you're teaching them and it can be quite didactic, or they do simulation, but then to actually go out into the real world and get their hands dirty, how do you account for that in how much of the transition relates to their knowledge retention?
Oh, you're talking about at the completion of the program, that period of time after. It's a good question. I'm not really sure how we can measure. We all know that practice helps knowledge development as well, and it's sort of a little bit of the chicken or the egg. With a bit of knowledge, is their practice able to develop more and they're able to take on more knowledge, or is it that that the practice is developing knowledge in itself? And I'm not really sure how that would really be determined. I would like to use the quiz in itself to review changes to the program, and certainly with a view to a pre and post assessment. That T3 assessing really was to sort of give us a little bit of reassurance, is that what we were getting at the end of the program wasn't just immediate recall, but it really was true knowledge that was then retained for a period of time. I don't know whether I answered your question. But
yeah, thank you. I mean, one of the question about exposure to practice was something that I've been struggling with for a time, so I was just interested in your take on how you factor that in.
Yeah, if you have some ideas.
I don't, that's why I was asking.
Okay, so I think we have a question here, and then I think there's another question. Fenella at the back.
Go on, Hol.
Question as well.
I guess leading on from Deb's question, then when you looked at the maintenance of knowledge in
Mm-hmm.
the transitional special practice program candidates from the completion of T3 to the 5 to 6 months post, or 4 to 5 months post, is there room to provide ongoing support or thought around further support and development to then further increase the knowledge
Yeah, that's a good question. I mentioned that we'd looked at changes to the program, and as part of, there was a paper released sort of after my literature review, but when I was looking to sort of finalise my thesis, and it was actually looking at a transition to specialty practice in emergency nurses, and that was looking at what is the ideal timeframe for transition programs. And their recommendations was that around about a 6-month timeframe is the ideal, that anything longer than that you tended to get less transition to postgraduate studies, whether that, you know, if they've done a year-long program, why do I need to go back and study again? But that the shorter programs didn't quite provide enough, and so what we've looked at, part of our program, is extending it out to more of a 6-month program where we stay with the more intensive 12 weeks, but then from 12 weeks to 6 months, we then provide some workbooks and sort of self-directed or self-guided learning to sort of help consolidate some of that knowledge that they might have gained earlier on. And that's sort of covering the more complex stuff like inotropes and ECG analysis and those sorts of things.
Okay, this will be our final question for the session.
Thank you, Fenella Gill from Perth. Thank you for your presentation. I enjoyed it. I guess I was intrigued that the score of the experienced nurses was not high, and I wondered whether you wanted to comment on the characteristics of those nurses.
Yeah, so
Honestly.
it was better, and interestingly enough, it was higher than I think the average score for the initial PQ nursing knowledge skill test when looked at a percentage basis. But yes, so does that mean that the questionnaire is too difficult? It's maybe, and so looking at the individual items and the individual item analysis, which was sort of part of the thesis, but it's probably a bit beyond the scope of a 10-minute talk. We'll look at exactly what items worked, what items didn't, and whether there's some modification that needs to happen in that regards, or whether we need to roll out a bit more education.
Sure. I guess I meant really was there quite a spread of the experience, a range of the nurses who completed the test?
No, a large majority of the nurses had completed postgraduate studies in either adult critical care or paediatric critical care. There was a couple that hadn't, but I think... Pardon? But there wasn't really a big enough population variation to be able to sort of pull it out to see. I think in Deb's initial analysis she had a bigger population with the larger test, and certainly in that nurses with paediatric critical care qualifications were scored higher than those with general critical care qualifications. But I think I only had 2 out of the 25 who did that, so I couldn't really sort of pull out the differences in that.
Great. Thank you, Kim. And thanks everyone for staying, and I would like to say thank you to all the presenters for some great presentations. I've really enjoyed this session, so I wonder if you'd just join me thanking all of the speakers this afternoon. And just a reminder, it's off to lovely opening drinks now, followed by the paediatric dinner, and look forward to seeing you all at both.
There are some tickets available for paediatric dinner if you're interested.
Oh yes, if you don't have a ticket for the dinner and you've changed your mind now and you really want to come, I think you can still get a ticket.
Thank you, Tina.
Thank you.
All my life you're haunting me. I love you so.